Brain stimulation is actually an umbrella term for 6 different ways in which the brain can be stimulated. There are 3 invasive techniques which involve surgery to allow for direct access to the brain, and 3 non-invasive techniques that allow stimulation of the brain without the need for neurosurgery. Let's start with the invasive techniques. One of the best non-invasive techniques is deep brain stimulation. In this technique, neurosurgeons insert electrodes into deep parts of the brain. It is often used in the context of Parkinson's disease and other movement disorders, and the aims are either to increase movements or decrease abnormal movements. The second invasive method is the epidural cortical stimulation. In this technique, an array of electrodes is placed over the dura, which covers the brain. It's often used to reduce pain that doesn't respond to other treatments. The third invasive brain stimulation is actually not applied to the brain at all. It is vagus nerve stimulation, and it's applied to the vagus nerve in the neck. The neurosurgeon implants an electrode around the vagus nerve. The idea there is that stimulation of the vagus nerve changes the way the brain works. It has been used for treating depression, epileptic seizures, and a range of other conditions. Now let's talk about the non-invasive methods for brain stimulation. The first technique is transcranial direct current stimulation. The technique involves delivery of low voltage current directly to the scalp. Most of the current then travels through the brain, and that's how stimulation takes place. The technique has been used for treating depression, fibromyalgia, and other conditions, but more research is required, which is the reason it has not yet been approved by the FDA. The second method is transcranial magnetic stimulation. It involves a strong magnetic field which is created around the head, and that magnetic field causes changes in electrical activity in the brain. TMS is best known for its extensive use in treating depression, but it's also been used for treating neuropathic pain and for motor recovery after stroke. Electroconvulsive therapy is the third non-invasive method. A direct current stimulus is delivered until it induces a short seizure, which lasts somewhere between a few seconds to a minute. ECT is best known for treating depression and other conditions such as schizophrenia. Hopefully now you better understand the landscape of brain stimulation. Please share this video with anyone who you think might benefit from it. See you next time.